Management of colic in horses. Colic refers to abdominal pain in horses caused by disorders of the gastrointestinal tract such as gas accumulation, intestinal spasms, impaction, displacement, or torsion. It is one of the most common emergencies in equine veterinary practice and requires rapid diagnosis and treatment. Immediate first aid, initial management. When colic is suspected, the following steps should be taken immediately. Basic management. Remove all feed from the horse. Allow small quantities of water. Walk the horse slowly to discourage rolling. Place the horse in a safe, quiet environment. Monitoring parameters. Heart rate, normally 28 to 44 beats per minute. Respiratory rate, 8 to 16 breaths per minute. Mucous membrane color. Capillary refill time. Gut sounds. Warning: excessive rolling should be prevented because it may lead to intestinal displacement or torsion. Veterinary clinical examination. A veterinarian performs a complete examination to determine the type and severity of colic. Diagnostic procedures include physical examination, rectal palpation to detect impaction or displacement, nasogastric intubation for gastric decompression, auscultation of intestinal sounds, blood tests, PCV, total protein, lactate, abdominal ultrasound, peritoneal fluid analysis, abdominocentesis. These tests help differentiate between medical and surgical colic. Medical treatment. Analgesics, pain relief, pain management is essential to reduce stress and inflammation. Common drugs. Flunixin, meglumine, Bonamine, most commonly used NSAID. Ketoprofen, phenylbutazone, xylazine or ditomidine, sedatives with analgesic effects. Purpose: control severe pain, reduce intestinal inflammation, improve comfort of the animal. Antispasmodic drugs, used particularly in spasmodic colic. Example: hyoscine butyl bromide, Buscopan. Action: relaxes intestinal smooth muscles, reduces spasms of the gastrointestinal tract. Fluid therapy. Fluid therapy corrects dehydration, electrolyte imbalance, and circulatory shock. Routes: oral fluids via stomach tube. Intravenous fluids. Common fluids: Ringer's lactate, normal saline, balanced electrolyte solutions. Nasogastric intubation. A nasogastric tube is inserted to relieve gas and fluid accumulation. Prevent gastric rupture. Administer medications and fluids. Substances administered may include mineral oil, electrolyte solutions, laxatives, and lubricants, used mainly for impaction colic. Examples: mineral oil, magnesium sulfate, Epsom salt. Function: soften intestinal contents, facilitate passage of impacted feed. Surgical treatment. Surgical intervention is required in severe cases such as intestinal torsion, strangulating obstruction, severe intestinal displacement, non-responsive medical colic. Common surgical procedures include correction of intestinal displacement, removal of obstruction, resection and anastomosis of damaged intestine. Early surgical intervention greatly increases survival rates. Nursing and supportive care. Proper supportive care improves recovery. Important measures include maintain horse in a quiet stall, monitor heart rate, gut sounds, and fecal output, gradual reintroduction of soft feed and forage, maintain adequate hydration, continue veterinary monitoring. Prevention of colic. Good management practices significantly reduce the risk. Preventive measures: provide clean fresh water at all times, avoid sudden changes in diet, feed high-quality roughage, maintain regular deworming schedule, provide regular exercise, avoid feeding large grain meals. Colic is a serious and potentially life-threatening condition in horses. Successful management depends on early recognition, prompt veterinary treatment, pain control, fluid therapy, and appropriate surgical intervention when necessary. Proper feeding and management practices are essential for prevention. If you found this video useful, please like, share, and subscribe to our channel for more veterinary educational content. Don't forget to press the bell icon to stay updated with our latest videos on animal health, veterinary medicine, and clinical practice. See you in the next video.